We found our two meanings of life is to educate others, save human lives, do our best, and contribute societies. We are nursing department of Draven University.
Our vision, nursing department, Draven University is one of the recent leading nursing academic institutions offering professional nurses. We like to accomplish three following missions. Firstly, to prepare professional nursing with academic excellence along with the moral, ethical standards and social contribution. Secondly, to develop the nursing professional with a global perspective to share nursing practice with diverse adaptation. From then, nursing department produce successful graduates who meet those needs. We identify the educational philosophy of nursing program, developing a competency-based education with student-centered teaching, applying evidence for patient-centered care. The nursing department of School of Medicine and Pharmacy rests here in our shared value and perspective so that this may guide us in our teaching, research, and curricular decision making. The School of Medicine and Pharmacy started implementing the Bachelor of Nursing program in 2012 to create a high-quality human resource for healthcare to promote the development of the nursing industry in Vietnam. The program improves constantly every year from 2012 to 2020.
Patient-centered care, including pediatric patients. In the nursing education programs, there are pediatric nursing care, nursing basic pediatrics, and public children's critical care, children's critical care practicums, on for the best health care for children.
We strive for excellence in educational programs that position our graduates for leadership roles in healthcare settings of the future, and able to adapt to and direct a rapidly changing healthcare environment. We believe in lifelong learning and modeling leadership within the profession. They demonstrate this through their practice, research, and participation in scholarly activities.
Obstetrical nursing is a nursing specialty that the nursing will care the patient. The patient is the mother, the woman, and take care the baby. Obstetrical nursing provide knowledge, skill, experience for the woman in during delivery. So that's on this is a safety and quality in delivery room.
The learning environment is flexible and student-centered, allowing for a free exchange of ideas. Teaching and learning are an interactive process whereby both teachers and learners assume responsibilities for the acquisition of knowledge.
Welcome to Fundamental of Nursing. This course can learn by students in the second year. They can study theory about the history of nursing and some information to come on practice skills like vital child, IV Lewis in they boost DQ into hospital.
The skill labs are where students will be introduced to new skills, be expected to practice, and be evaluated on their skills. As students travel through nursing program, students will spend time in the nursing skill labs during each semester, where the students are learning new skills, reviewing drivers' learned skills, or being evaluated on knowledge and psychomotor skills. Simulation will be a key component of all these elements, whether it is using a simple test trainers or a complex full-body mannequin with herself. The nursing skill labs works in a conjunction with the nursing faculty to coordinate nursing theory and clinical courses. Students have opportunity to practice independently with their peers, with lab assistants, and with faculty to develop these skills. How much time students dedicate to practice is dictated by how quickly they learn and by the difficulty level of the skill. By using the provided equipment, students are able to simulate a clinical setting where they have the ability to learn and practice safely without causing harm to patients. The clinical setting is not a practice setting. The goal of nursing skill lab is to provide an opportunity to become competent with student nursing skill and thereby becoming a safe practitioner. Nursing industry typically belongs to technical professions and brings huge effects to human well-being. Therefore, experience-based learning is most important through clinical training to acquire professional skills. However, in the modern context, the natural environment and society changes constantly, and the needs of healthcare also keep moving. Thus, students are equipped with the ability to self-study and self-research, to engage continuing education and adapt healthcare settings. Experiential learning at healthcare facilities with direct instructors, lecturers, and receptors. The application of evidence-based medicine in care and innovative thinking are designed across specialized and complementary modules. This activity is a process of experiential learning starting from the second semester of the second year to the second semester of the final year to help them to build the competencies in taking care of the sick according to the nursing process. Starting from the second year, students are allowed to participate in short-term practicums in occupational skills including patient care, health education, nursing management at a hospital in the province, including General Hospital, Obstetrics and Pediatrics Hospital, Hospital for Tuberculosis and Learning Disease, district health centers, and several medical stations in the province. In the last school year, students will experience a long-term internship at first-class hospital or tertiary hospital outside the province to expand the scope and specialization of the content of professional care practice. In addition to the strategy for giving learner access to a variety of medical centers, with multiple levels from primary medical center to specialized medical care, to create opportunities for students to choose a working environment as well as promote the image of students who are going to graduate for the future employers.
Hi, I'm in charge nursing care adult division, including medical nursing care 1, 2, surgical nursing care 1, 2, and physiatric nursing care. And then when students finish each class, they can go to the hospital to practice how to take care of the patient. As well as they also experience about prevention. Welcome to Nursing Care Adult Division.
Lecturers give lessons in combination with group discussion and student presentations. In addition to classroom lectures, the university reinforces lecturers to put web-based learning into teaching learning methods through an learning network to support students in self-study and active interaction.
Welcome Communicable Disease of Nursing. This course can learn by students in the first year nursing program. Students will experience how to learn about the signs and signal and symptoms infectious disease as typhoid, mumps, dengue fever. Especially, they can discuss about the emerging infection disease as COVID-19, SARS, rubella. Finish this course, students can move to hospital to practice how to take care of infected patients, and they also to share experience how to prevent some disease. That's all. Welcome to our course. Yeah.
Lecturer led students to projects. Projects help them develop the skill needed to be successful in the workplace by empowering groups of students to work independently, designing their own schedule, and reporting results. Professional portfolio and reflection writing are required in several courses and specialties. Self-assessment and self-monitoring skills are needed to be trained for lifelong learning. Nursing educators can primarily facilitate professional values by urging students to participate both in research study on the topic and in nursing education.
A world without nursing is almost impossible to imagine. Everywhere you turn, nurses are there to provide the leading treatment to patients from water supplies. Nursing works in various settings, including churches, businesses, and schools. Besides hospitals and clinics, they work with people throughout the lifespan. We are the Community Nursing Division.
The professional practice matters of the program are always linked to health facilities, from the local to the central cities. Students are involved in primary healthcare and vaccine prevention in community practice care matters. The Bachelorette program prepares nurses to practice effectively as generalists within the healthcare system, functioning in roles as providers, designers, managers, and coordinators of care. The program fosters the development of professional values and value-based behaviors. To enhance capability of both lecturers and students, nursing department also pays attention to international cooperation. Up to now, we have made some significant achievements such as exchanges with institutions from America, Japan, Taiwan, and Philippines. The goals of the school and department are to consolidate ongoing agreements and to establish new agreements for expanding student exchange and research collaborations. 21st century, nurses are those who go on their healthcare journey through patients' experiences and values. Wherever and whenever there is someone in need of care, nursing works tirelessly to identify and meet individuals' needs. Nursing department is committed to training undergraduate students with solid medical knowledge, professional skills, research, and leadership skills.